say that masks only matter if you're sick in order to reduce transmission, which this is actually in line with what the research says.
Well, the World Health Organization, thousands of doctors, public health specialists and scientists from around the world, it says healthy people do not need to wear a face mask when they go about their daily business.
One of the reasons that people wear masks is they think that it's going to protect them, but the virus isn't floating around in the air, so it's not protecting me against anything because it's not there.
When the wearer coughs or sneezes, the surgical mask blocks the large droplets. But on inhalation, air also flows in over the sides. That means it mainly protects others from infection rather than the wearer. Once the mask is wet from breathing after 8 hours wearing time at the most, it has to be discarded.
We don't recommend wearing a face mask unless you are coughing or sneezing a lot. People misunderstand the face mask. They think the face mask is about protecting themselves. It's actually about protecting others if you are producing a lot of respiratory droplets.
There's no evidence to show that masks stop you from getting coronavirus. Masks themselves can actually become contaminated and infect you.
And if you're not sick, you shouldn't be wearing a medical mask. But if you are, then you should.
It's probably going to be on my hand because I've shaken hands with someone who's got the virus, and I have transmitted it. I have carried the virus to my face.
Also, masks give a false sense of security, so you may feel better protected than you actually are. And they say masks may make you less likely to wash your hands or practice social distancing.
If you're in an environment where everybody else is wearing a face mask and you're not, then it may make you feel vulnerable because you feel like you don't have the protection everyone else does. But logically, if you're not close to people, they're not coughing and sneezing on you, then a face mask isn't necessary.
Now that said, if you are sick, just stay home. Why are you leaving the house? It's one of the most infectious viruses ever. So just stay home. You're sick anyway. You feel crappy. Get a bowl of soup and watch YouTube videos. This should be the recommendation of the US government, of all the doctors, of everybody. The recommendation should not be wear a mask even if you're healthy because reasons. Many people say, well, you can spread it asymptomatically. That is, you may not know that you're sick. Wrong.
Even if there is some asymptomatic transmission, in all the history of respiratory-borne viruses of any type, asymptomatic transmission has never been the driver of outbreaks. The driver of outbreaks is always a symptomatic person. Even if there's a rare asymptomatic person that might transmit, an epidemic is not driven by asymptomatic carriers.
We have a number of reports from countries who are doing very detailed contact tracing. They're following asymptomatic cases, they're following contacts, and they're not finding secondary transmission onward. It's very rare.
The WHO epidemiologist who made the statement later explaining herself on Twitter, saying pre-symptomatic patients, those who show no initial symptoms, are a transmission risk, whereas asymptomatic patients, those who never show symptoms, are much less likely to transmit the virus.
Now, many in the media have pointed out that the WHO walked this statement back, but they actually didn't. This was the correction that was actually made.
So there were quite a lot of messages that I received overnight and that we received about making some clarifications to some points that I made yesterday at the press conference. And so the majority of transmission that we know about is that people who have symptoms transmit the virus to other people through infectious droplets. And so what I was referring to yesterday in the press conference were a very few studies, some 2 or 3 studies, and that's a very small subset of studies. I also referred to some data that isn't published. We convene global expert networks, and I was referring to some detailed investigations where we had reports from member states saying that when we follow asymptomatic cases, it's very rare, and I use the phrase very rare, that we found a secondary transmission.
So clearly there was some kind of pushback on the original statement, but the WHO and Maria Van Kerkhove did not actually contradict the original statement. The statement was merely put into context, but the original statement was correct. Every study shows that asymptomatic spread is incredibly rare. So for healthy people or for people infected with coronavirus but who are asymptomatic, masks do not help stop